Our practice relies on ultrasound during pregnancy for a variety of reasons. At a patient's first visit, it is used to confirm that the pregnancy is viable and in the correct location. It is also used to establish or confirm a reliable due date. Second trimester ultrasounds are performed mainly for anatomy screening, with specific attention to various organs and structures such as the heart, brain, kidneys, and spine. In a great majority of cases, the gender can be determined during the second trimester as well. If the second trimester ultrasound is normal, further ultrasounds are not recommended unless there are specific concerns, such as gestational diabetes, increased blood pressure, or suspected excessive or decreased fetal growth. Any suspected abnormalities on ultrasound are referred to a high-risk obstetric specialist for further evaluation. We also offer 3D ultrasound packages, which are a fun way to look at your baby. Inquire with the reception staff if you wish to schedule a 3D ultrasound.